So let me introduce you to our audience. It's 9:10 a.m. in Sri Lanka, Colombo. In our audience, we have nurses, nursing tutors from both the government and private sectors, and from the universities that conduct nursing programs as well. So the next speaker, who's going to talk about disruptive technologies in nursing as a profession, Ms. Joanne Foster. She's a lecturer at the Faculty of Health, School of Nursing in Queensland University of Technology, Brisbane, Australia. And her research interests are education, nursing, informatics, and nephrology nursing. She has multiple qualifications in information technology and nursing, and she has many publications under her belt as well. With the best interest of time, I'll limit the introduction to that. Over to you, Joanne.
Thank you. Thank you for the welcome. It's nice to be able to present here. I'm just going to be talking on disruptive technologies, and I guess from a nursing perspective, there's actually very little in the literature about disruptive technology in nursing. There's a little bit about disruptive innovation and some of those aspects, but actually very little about the technology itself. And I guess some of the changes that are coming through where consumers or healthcare consumers are pushing to ensure that they have a much quicker, cleaner, flexible, value-based contemporary healthcare system to be able to function in. And healthcare itself has not really embraced a lot of the disruptive innovation or technologies compared to many other businesses. So healthcare itself lags behind quite significantly. I guess for nurses, part of the reason for this is related to discomfort and technology insecurity and feeling overwhelmed with a lot of the technologies that are being pushed onto nurses, as they often do not have actual impact in relation to development of a lot of the systems and technologies around. And that is often part of the bigger picture, I guess, or bigger issues of why nurses do not undertake a lot of these sorts of aspects. There's also quite a bit of problems with poor acceptance of change from nurses as well, and also I guess the perceived power imbalances as well. And I guess this comes through from the aspect of nurses not being involved in many developments from both government and from healthcare sort of development sort of businesses and associated aspects as well. And I guess too, part of the reason can be part of that poor perceived value of technologies as well. I guess part of this major change in these technologies has come through with communication, and more specifically I think social media has been one of the biggest disruptors from technology just over the last short while, and things such as telehealth, hospital in the home, digital hospitals, electronic health records, the biosensors that people are now using in the home, and sharing with people is also extremely impacting on this communication aspect as well. And nurses are also looking at how to get the balance for actual patient-centred care and also continuing our nursing care with the technologies, not overtaking that. And part of that seems to be a bit of an issue as well. And as the largest group of health professionals nationally and globally, and with patients and consumers being the largest group impacted by the point-of-care technologies, new models of care are beginning to evolve, but nursing has not yet grasped this, and we must push for change and innovation in nursing practice to ensure appropriate development, implementation and management of these technologies and this should hopefully increase our patient or the lived experiences for consumers and the quality of nursing care and healthcare outcomes. So as for nurses, we actually really need to broaden our knowledge levels of other disciplines such as business, information technology, design, engineering, social science and health. And I guess it's really trying to incorporate a number of those multidisciplinary people into those sort of developments that we're looking at now. So we have to have a much more broader base of knowledge. And a lot of this will make sure that we have that human-computer technology interface and design, as well as the required infrastructure for systems and technological use. Could I ask where my slides are? Hello? Are my slides available?
No, Joanne. Unfortunately, we can't run them at the same time. What we will do is we will run them separately, after the session, and we will make it available to the audience.
Oh, okay. Oh, well, I might sort of need to talk through some of that then, because I was going to be talking to a lot of the slides. So I guess from a definition perspective, disruptive technologies themselves actually replace existing technologies and impact on the traditional business methods and practices. So realistically, what you're looking at is that these technologies should replace a current technology. So an example of that could be with electronic health records. So instead of the paper-based systems, we now have electronic health records. So that's one way that a disruptive technology has actually replaced an existing technology, and certainly should make it much easier for access of information. There are a number of current changes in healthcare that are causing a lot of, or promoting a lot of the current changes in healthcare reform sort of globally, and the majority of these issues seem to be seen in some shape or form in most countries around the world. One of the big ones is certainly the power shift to the patient and consumer, and they are really driving a lot of the changes that are now happening in healthcare. And that's because they now have access to their own health records, they have access to the same literature that we do, they are partaking or involving themselves in the social media and the social networks and finding a lot of information and availabilities of different technologies and research that may not be published as well. So the really big power shift is now moving towards the patient or consumer. The personal data, a lot of people now are using biosensors, and a lot of these can be aspects in relation to whether it be things like your Fitbits and those type of things, Google Watch, any of the Apple Watch, all of those sorts of things where people are checking heart rates, they're checking how many steps they're taking, they can look at diet, they can look at sleep, they can look at a whole range of aspects. And there's also been a lot of new sensors being developed where for people such as diabetics who can now actually have either what they're calling tattoos or implantable devices which can actually automatically read their blood sugar levels instead of having to prick fingers. So a lot of these things are really changing and moving how the technologies are going to impact on our practice. There's also been an increase in venture capital in healthcare. In 2013, there was $955 million US spent on venture capital for healthcare technologies and new developments. So that's an enormous amount of money that they're currently spending in the space. And that keeps getting incrementally more each year as well. We're starting to look at patients or consumers staying in the home now. So with, the hospital in the home, a lot of the aspects of telehealth and things is enabling people to actually be looked after at home now instead of in hospitals. And that's certainly slashing the cost of healthcare, which has been one of the big barriers of sustainability. And the other aspect that's really sort of causing a lot of these changes as well is the shift of care to prevention rather than treatment. And for us as nurses, I think that really links into what we have as part of a major value of our practice is in health prevention and health promotion. And that is now getting much more of a push and will open up a lot of avenues for nurses to have a lot of change in what our workflows and the areas that we work in as well. Obviously then it's how do we efficiently and seamlessly bring health professionals, policy, governments, etc. to these changes. Now, as I've mentioned, some of the new technologies do include the things of digital health such as electronic health records. There's participatory health where you're actually working in participation with consumers. genomics, which is having quite a lot of impact, particularly on the quantified self or patient focus, any of those sort of aspects of personalised medicine or personalised health. Social media, as I said, is having a major impact, and the Internet of Things is producing a lot of new technologies for people to utilise that can then link into health professionals and how we actually go about doing our practice. 3D printing is also having major impacts as well. People are using that in all sorts of ways, from bone replacements for body parts. They're looking at actually producing organs through 3D printing. There's a lot of medicos in particular who are probably using 3D models, which they do from 3D printing prior to doing surgery of complicated cases. So it's being used in all sorts of ways and is going to continue to increase because it is a fairly cheap way of doing printing in some aspects. As I mentioned, the wearable or the implantable sort of sensors that people are using. Nanotechnology is another area that has a lot of promise and I think will have quite a lot of impact in the future as well, particularly in relation to being able to transport drugs to specified sites, such as in chemotherapy. So instead of having the impact on the whole body system, it will just actually target the actual cancer cell areas themselves. So there's a lot of work being done in those areas around the world. I think probably Israel is one of the leading areas in that regard. And robotics is the other aspect which is really tending to move very, very quickly for a lot of avenues in relation to care. And I have some images of all of those different sorts of technologies in my PowerPoint slide pack when you get to see that. I also have a slide in there about when we're looking at what the patient of the past was looking like and what they sort of look like in the future, and a lot of that is about that they are rejecting a lot of the large institutions and authority, and that is about that change in power play where the health consumer is starting to take control over their own healthcare. They often want personalised aspects of healthcare, so it's not about that standardisation of everything, so that is impacting quite significantly. And having ability to access all of that information has been another really big impact as well. For the impact on nursing, I've got a few sort of areas which are on my slides as well when you get them. First, and probably one of the really, really important ones that as nurses we have to start really looking at is data, information and knowledge management. Now, and certainly with in the coming sort of near future, we're really going to be mainly sort of knowledge workers, and it's how we access the data and can actually and the information and turn that into knowledge, and then how we actually curate that information and knowledge to be able to communicate that both within the healthcare arena but also with our patients or health consumers as well. Elizabeth would have been talking about competencies in relation to a lot of this particular aspect, and certainly they're looking at things such as self-technology assessment so that people or nurses can actually look at what is your skill base in using the different sorts of technologies and what areas do you need to increase. The actual competencies are probably covering three major areas. Certainly just the general information and communication technology skills. So can you use a computer? Can you use a lot of the social media networks, etc.? So all those basic sort of technology skills. It's all about the data, information and knowledge management, and it's about governance and also the professional issues that go around the legal and the ethical issues that we have within nursing practice. The new generation of nurses also expect technology integrated into practice, so we have to start looking at what these current younger people are doing now and what they are looking to utilise within their practice in the future, because that is usually quite different from what we currently have at the moment. End user usefulness, any technologies have to have simple, easy interfaces that are quite intuitive for most nurses to use, and that's a really sort of big aspect that also needs to be taken into consideration in development. As a number of you are nurse educators in the audience, I think that's a really big area for us that work in the education sector for nursing and also in professional development to look at all the different sorts of technologies that are available and how we can use those to be incorporated into our educational practices. Some of the major ones that are currently being used would be simulation and virtual reality. I think they're probably two of the big ones, but I think overall within our theoretical education we have to start looking at how we include all of these technologies. And the other big changes for nurses, probably more so at the coalface, but certainly impacts back on those in management, education, etc. as well, are the workflow changes that are coming through from these disruptive technologies. We do have informed consumers, so they are coming in with a lot of information. They are wanting specific things from us as a healthcare professional, and they are quite vocal about what they are wanting nowadays as well. So that power shift, and it's leading more to us as having a more facilitative role with our patients or consumers than what we have done in the past. That person-centred or personalised healthcare is also going to cause some workflow changes for us. So instead of having everybody treated the same, we're going to be looking at individuals and how we're personalising the actual healthcare journey or experiences for them. The other aspect is the seamlessness. There needs to be a seamlessness between when patients are moving throughout the different healthcare sectors from primary, secondary and tertiary areas, and that is something that certainly isn't done at this point in time at all. The increase in primary healthcare and health prevention, health promotion is going to increase significantly. Acute care is going to decrease, and a lot of the newer technologies are going to enable body parts to be renewed, replaced, etc. So we won't necessarily have a lot of the complex disease processes that maybe we deal with today in the near future. So that will also cause major changes in our actual practice. As I said, the use of social networks is massive, and that's really been one of the big drivers for a lot of the disruption, and the different sorts of technologies and different sorts of platforms that you can use, and how people share that information of what sort of technologies are available and how they can be utilised, or how a particular disease process may be dealt with, and people are talking from all different countries about what is available and what isn't available. So that leads into that power consumer push as well. So we as nurses need to make sure that we keep up with that. And I think there are a number of countries around the world who have a lot of traditional medicine that is still practiced, and I am aware that Sri Lanka is one of those that does a lot of traditional medicine. And again, it's incorporating traditional medicine practices with these technologies and how we utilise and implement them in our practice, which is quite important as well. The legal and ethical aspects, what sort of skill sets or competencies we're going to need to become registered nurses, how that's going to actually be credentialed, etc., are going to have to be looked at. The current legislation for healthcare and nursing also will need to be looked at in relation to changes that are coming through based on these technologies. Our ethical standards also will need to be reviewed, refreshed, and had a change in relation to how these things are undertaken as well. Now, there are a number of images in my slide pack, and there is also a YouTube video on social media revolution for 2015, which I think is worth a look. It does give you some idea of the impact of social media currently in 2015, and it's well worth a look. Some of the others are just to give you examples of telehealth, the nanobots, the actual type of tattoos that they're implanting, the robotics in relation to them being used in both care assistance, as in they can do a lot of lifting, taking people to showers, taking them from bed to chairs, doing a lot of those sorts of things, right through to diagnosis, and for social and sometimes mental health support services and structures as well. And just a couple of There's a slide there that's showing a lot of the current sort of sensors that are available as well. There was another slide on digital health. There's 753 companies involved in digital health and the different areas that they're involved in. The type of social media aspects that are happening every minute of the day is quite astounding when you look at some of the actual numbers of what's being sent around those social networks by people, and obviously that's covering everything, not just healthcare, but the people that are talking around healthcare in the social media space is quite high. And there's just one little cartoony one at the end, which is just about whether we end up being looked at as being looked after by robots in the future, or whether maybe that's just a bit of a figment of our imagination that that's where it will go. But a lot of things are not known, but I guess from our perspective as a profession, we must be proactive. At the moment, we're quite reactive, and I think we need to start being very proactive, and we must sort of look at our nursing leadership, and that the leadership, so managers, leaders, anybody in those sorts of roles, have to start really driving innovation, being proactive, looking at these disruptive technologies and how we can actually start to implement them with a nursing focus, and not from other health professions or other groups that are involved in a lot of these healthcare developments, to make sure that we are getting what we need to maintain our nursing focus. From education, we certainly need to be looking at contemporary and future innovation and the use of disruptive technology changes within what we do in education. And we also need to be looking at the new skill sets that are required for this change in how we're going to be managing and delivering nursing care and healthcare in the future. And also those changes to nursing legislation to meet these disruptive changes, because the legal aspects in relation to technology are certainly lagging in the healthcare area quite significantly, and it's a matter of the legal side of things has to sort of catch up with the technologies, and as nurses we have to be proactive, be innovative, be involved, take control over what is actually happening in our space, so that it's us as nurses who are actually controlling what these changes are and not other people telling us what to do. So I guess really just to finish up with this, I guess the time for complacency is really past, and we've got to embrace innovation. We have to look at and utilise these disruptive technologies. We have to be innovative in how we use those in our nursing practice. We have to be very keen to put in appropriate change processes so that these things are undertaken in a appropriate, effective manner, so that we are getting the best outcomes by the use of these technologies to enhance patients or the lived experiences of people throughout the healthcare sector, and certainly from a nursing care perspective. And I guess the other aspect that I think is quite important is nurses need to start to feel empowered. I still think nurses feel they don't have any power in the healthcare system, but I think it's up to us. We are one of the largest healthcare professional groups worldwide, and I think we could have massive impact if we started to sort of work together and start getting that power base to be able to make sure that we are a major player in this field. At the moment, I think we're pushed down quite a lot, and I think we have to start really being out there, being proactive, taking those leadership roles and taking it up to all of these other people and disciplines who are involved in healthcare technology. And these things are rapidly changing. We can't afford just to sit back anymore and just take whatever's given, or use systems that are given to us that are not appropriate for or meeting our needs as far as being able to deliver good patient care to make sure that we have very positive health outcomes for our patients. So for me, it's about us as a profession taking control of what happens to us, and not leaving it to other people to impact on what we will and won't do within our own nursing practice. So I hope that some of these points that I've sort of tried to highlight a little bit today will give you some food for thought to have a think about what some of these things might impact, how they're impacting, how consumers are now empowering themselves, and how we're going to have to work within this space in the future. The different types of skill sets that we're going to need, the changes to education, the changes to our workflows at our practice levels, they're all major impacts from us as nurses for our profession. So I do hope you find some interest out of that, and I hope that the slides are useful for you as well. And I'm sorry I couldn't show them as I was going through my talk. So thank you very much and appreciate your attention.
Thank you, Joanne. And Associate Prof. Elizabeth is not with us yet. So we have 10 more minutes till the scheduled time for conclusion of this session. So I can open the session to the floor for any questions. So I'll start with a question by myself, Joanne. Now, in this conference, eHealth Asia 2015, one of the things that we've been focusing was how to keep the focus fixed on health while working on eHealth initiatives. Now, one of the problems that we face in Sri Lanka, especially in the private sector, when the newer systems, when computer systems, let it be an EHR, is implemented in the hospital, the nurses, especially the trainees, worry too much about the system than about patient care.
Mm-hmm.
So, like, I would like to add EHRs to your list of disruptive technologies, but in settings like ours, it might actually be.
Yeah, I think that's certainly an issue and has been, I think, for some time. I mean, when we think about practice and how that's changed just even over the last 10 to 15 years, even things now such as our IV monitors and things like that, we have a lot of staff who go into rooms just to turn alarms off and things like that and actually don't interact with the patient. And I think it comes back to part of how we educate, and that we actually look at the technology as not being the driving thing, it's just a tool that we use to support our practice. And I think that comes back to how we educate our students so that they're not getting overwhelmed with the technologies and actually still just seeing that as like, you know, we go up and take a blood pressure on somebody, we're still assessing the person, we're talking to the patient, even though we might be using a technological tool such as one of your digital blood pressure machines. You can't just read what's on the machine. You still have to be able to look to make sure that that is still an appropriate reading that matches up with what you're seeing and finding out from your patient visually or audibly and those sort of things as well. So I think it's an issue that is quite current, and it's something that I think we really have to look at, making sure that people don't get stuck or hung up onto the technology, but actually look at it being just a tool to support what we're doing for our patient care. And for me, that comes back to education. And I think part of what happens when systems are implemented is that they're often just pushed in quite quickly. People don't really get a lot of education, and then they get so paranoid about, you know, because they don't really understand the systems and how they're working and what they're doing. And again, for me, that comes back to education. And a lot of times that change process that is undertaken is not done appropriately during implementation, and that's where I think a lot of nurses don't necessarily get the full understanding of what the system does, what the piece of technology does, and it's how we include that change process into the implementation process, which does include an educational component, and that's usually one thing that is really done quite poorly globally.
Thank you. Any more questions from the audience?
And I apologise, I was trying to speak slowly, so I hope I didn't speak too quickly.
You didn't, like, I'm sure they are used to that sort of a pace.
Oh, well, that's easy, no more questions.
Yeah, in the absence of the questions, I think we can conclude this session. Thank you very much, Joanne, for joining in with us.
Thank you very much for having me.
Ladies and gentlemen, yeah, most welcome.